Ma, are you okay? You okay?
Is this just how
I know that. I get that. How's everything going over there? Like actually not song. No.
Good morning, everyone. Thank you so much for being here today for our Wound Care Center ribbon cutting and open house. We do know that this is not something new to St. John's, but we are here to reintroduce the Wound Care Center and tell you about the changes that have been made so that we are able to provide quality care to our patients. At this time, before we get started, I'm going to ask our Reverend Cicely Broderick, our Vice President of Missions, to come and do a prayer.
Refer to your programs. O God of peace, you have taught us that in returning and rest we shall be saved. Through community and service we will find strength. Send your Spirit to this place. Empower the clinical and support team members who serve in wound care, as well as the patients and caregivers who come here seeking help and wholeness, that they and we may know that you are God, the great physician, able and willing to restore health and grant eternal life. People. Amen. A reading from the Book of Kings.
But when Elisha, the man of God, heard that the king of Israel had torn his clothes, he sent a message to the king, "Why have you torn your clothes? Let him come to me, that he may learn that there is a prophet in Israel." So Naaman came with his horses and chariots and halted at the entrance of Elisha's house. Elisha sent a messenger to him, saying, "Go wash in the Jordan 7 times, and your flesh shall be restored, and you shall be clean." But Naaman became angry and went away, saying, "I thought that for me he would surely come out and stand and call on the name of the Lord his God, and would have waved his hand over all the spot and cure the leprosy. Are not Abana and Pharpar, the rivers of Damascus, better than all the waters of Israel? Could I not wash in them and be clean?" He turned and went away in a rage. But his servants approached him and said, "Father, if the prophet had commanded you to do something difficult, would you not have done it? How much more when all he said to you was, 'Wash and be clean'?" So he went down and ministered himself 7 times in the Jordan, according to the word of the man of God. His flesh was restored like the flesh of a young boy. He was clean. The word of the Lord.
So I offer an outrageous proposition on this day, that what we do here in wound care, in point of fact, what we do throughout this hospital, is offer healing that points to one who gives us all life and intends that everyone in this community, indeed everyone in this country, should have health care that is restorative. Lord, grant your healing grace to all who are sick, injured, or disabled, that they may be made whole.
Hear us, we pray.
Mend broken relationships and restore those in emotional distress to soundness of mind and serenity of spirit.
Hear us, we pray.
Bless physicians, nurses, technicians, clerical staff, housekeepers, and all who serve in wound care, so that through their work, suffering is relieved and health is renewed.
Hear us, we pray.
Almighty and eternal God, so draw our hearts to you, so guide our minds, so fill our imagination, so control our wills, that we may be wholly yours and utterly dedicated to the art and practice of healing, so that the good accomplished here gives honor and glory to your name.
Amen.
At this time, I'll introduce to everyone our Chief Operating Officer, Christopher Parker.
Great. Thanks, Renee. When we started this kind of venture to insource our wound center, I kind of pictured today of like 6 of us, but Renee knows how to throw a party. So thanks for putting this together. So good morning, everybody. As we mentioned, wound care has been part of St. John's for a long time. It has been run by an outside management company for the last 14 years. But in looking at trying to really launch a new day for St. John's and seeing how we run this hospital, I have great confidence in our leadership team and the talented people who work here. And so we decided that we could run this wound center ourselves and increase our capacity, increase our capabilities, bring in some new technology, and really improve and increase the services that we provide to the community. So, we set about that. It took us a good 6 months. I'm going to walk through a little bit of the process we had to go through to do that. And I'm going to probably get myself in trouble by acknowledging some people and inevitably forgetting someone. But first, let me just say and introduce the leadership team of the Wound Center. Dr. Tom Lebeski is here. Tom's been with us about a year or so, and he ran our wound center in my previous organization, and so we have great confidence in his vision and his clinical and medical leadership to lead this enterprise. A couple of our podiatrists, Dr. Tarantino, Dr. Hertz, are here. So they have been the key drivers of this wound center, and we over the years have trained. And the world is a better place for all of the really top-notch podiatrists and wound center specialists that have come through St. John's and gotten their medical training. So thank you guys for all of that. And then Eileen Van Ruzen is the Vice President of Physician Services. So that's our leadership team, but we really did have to go through a process to really bring this in-house. So I want to just acknowledge some groups of people that worked with us. So one of the things that about having an outside group is we use their electronic medical record. It's a proprietary product that they own. So we had to very quickly, in a short period of time, invent a medical record using our Athena platform. So to Dr. Thomas and all the IT team that helped work with us and work with Athena to get a new EMR specific to joint care, or wound care, so that we can really track what we do and document correctly, and that really enables us to help our patients, but also enables our billings and all of that. The finance team, Steve Guido, our CFO, Bertrand Batista, Jordan Cohen, Rosemary Bonilla. In looking at doing this, one of the things that we heard a lot was people who insource struggle with one thing, and that is making sure that you have the expertise to bill correctly, to get pre-authorization so that you get paid for the services you provide. So, that's not really expertise we had because the external company was doing that. So, really that group of people had to study hard and get up to speed in a very short period of time. But I think we feel confident that we have that ability now to really, on a financial business end of the program, really do a good job. Charmaine Thomas and the clinic operations staff, again, most of the employees who worked in the wound care center worked for the company, so we had to quickly hire, train, and get people in place in order for us to run it ourselves. So they worked really hard to do that, along with Sharika Gordon and Joan Crawford and the HR team. A lot of recruitment, training, and onboarding of staff in a very short period of time. Again, to Renee and Christian, one of our goals is to grow this program, to run it 5 days a week, full day services, expand the services we provide. So In order to do that and to grow this, we'll need help from the marketing team and external affairs team to help us get the word out of what we're trying to do. Tom Farzetta and the facilities team, you'll see as you go through, the place looks really, really good. To housekeeping and Frank and all the folks who help us keep this a place that we can be proud of and that the patients feel very satisfied in receiving their care here. Bill Fedorkis, our internal legal counsel. You know, we had to, again, in a very compressed time frame, stop one contract, develop another set of contracts, and really in order to legally run this place. So I really appreciate the effort of the legal team to do that. And then most of the stuff you're going to see had to be ordered, bought, implemented, and try to match a very tight timeline. So to Paul Wolf and the materials management staff, way in the back, hi Paul. 99% of the stuff arrived here and is on time, and we didn't miss a beat despite the snowstorm to get this service converted over exactly on time. So again, I just want to thank that whole team and anyone I missed. I thank you for everything you've done. We really were able to pull something off in a very short time frame. And I think our patients will appreciate, the community will be better served, and St. John's will be financially in a better place for having done this. So thank you, everyone, and thanks for coming.
Thank you, Chris. And it's always a privilege to be supported by our elected officials, being that we are a safety net hospital, and we are the only hospital in the Rockaway Peninsula. So we give our extended gratitude to our Assemblywoman today, our Assemblywoman Stacey Pfeffer.
Good morning, everybody.
Good morning.
I think you're modest, Kristen, saying that you would think 6 people would be here. I knew the room would be filled because Renee does throw a great party. But the fact that this hospital and its reputation is growing, and the confidence from the community every day that when something happens here that we're excited over, I know the room is going to be filled. And I am very excited to be part of the growth of this community and this hospital especially. And I say this all the time, but I was born here. And I feel committed to this hospital because it should be strong. I don't know if it should or shouldn't be the only hospital in the community, but it's a hospital that is going in the right direction. And as I stand here as a state legislator, knowing that where our dollars are going, I'm proud to fight for this hospital in this community. Knowing that you've taken, and I took your words, financial independence for yourselves, to know that you want to manage something shows confidence. I'll talk right over it. Shows confidence in the hospital and your management team. So congratulations. I know that Jerry's not here, but Chris, your team, Renee, because knowing that you want to take control, and all the names that you mentioned, purchasing, materials management, all of that together, your team is knowing that you want to have that control of the hospital, where the money goes, which is responsible for the dollars that I'm fighting for every taxpayer in this community. So we thank you. Congratulations on the wound center. I might be sleeping there later tonight. I heard it's going to do some things for my skin. I'm not sure. But so if you don't get me in the office, I'm here. But thank you for being here. For everyone in the community, I'm going to thank you for being here. But congratulations on this very exciting day.
Thank you, Assemblywoman. I also want to acknowledge the support from our elected officials' offices. So we have our Manny Silva, who's the Chief of Staff of Councilmember Richards. Thank you so much for being here. And of course, Malik Sanders, who's the scheduler for Councilmember Richards. Thank you so much for being here. To Felix, who is the new liaison for Senator Sanders' office. Thank you so much for being here today. And also Betsy from Congressman Gregory Meek's office. Thank you so much for your support. Please let our elected officials know that we do thank you for your presence and thank you for being here today. At this time, I'm going to introduce the director of the Wound Care Center, Dr. Thomas Lebeski.
Thank you, everybody, for coming today. This has been a full year worth of work for all of the people and the staff to try to get the Wound Care Center organized and going in the right direction. I just want to let you know how the machine works, because it's a big machine, it's very impressive, but unless you understand exactly what it does for people, you don't understand the value of the machine. Now, the machine is a hyperbaric oxygen machine, and what it does is it gives you 100% oxygen throughout your blood, your hemoglobin, but also the plasma. So when you have a wound and it's not healing, that area around the wound is necrotic, it doesn't have a blood supply. It has poor oxygen going to that area. When we stimulate it by putting you in that chamber, we make every part of the body that can be wet get oxygen. So now that area that didn't have oxygen before, all of a sudden the oxygen is coming to that wound. When it comes to the wound, capillaries can grow into that area, and when the capillaries grow, they bring the blood supply to heal the wound. So without the extra oxygen, every one of us is walking around, our hemoglobin is 98% saturated. In there, the hemoglobin is 100% saturated, and even the fluid surrounding the hemoglobin is saturated with oxygen. So now all of a sudden we have an increased ability to heal that wound that we didn't have before. Now what that will do is we'll save amputations. Amputations lead to faster deaths. It'll save tremendous amount of money because the rehab and all the other things associated with the amputations. So for our patients, it's a tremendous upgrade in having the ability to deliver this service. The machine that we used to have was 14 years old. So normally machines after 10 years, they have to be inspected every year. And after 10,000 dives, you have to get the seals checked every year. So we had machines that were 14 years old and had 11,000 dives on them. So now we have the brand new state-of-the-art machines. The machines that we have were 32 inches. So if you picture a 3-foot ruler, you were in that little space. A lot of people complained of being claustrophobic. The new machines are the biggest machines on the market. They're 40 inches. So now instead of having that glass right on the top of your face, it's a foot away. So now you have room where you're not in a confined chamber. The entertainment system was upgraded because you're in there for a long time. You're in there for an hour and a half. And so I think just for our patients, it's going to be a tremendous upgrade and a very needed service. We have our own staff, and our staff here is very important to what we do, so I'd like to introduce them all. The front desk people are Angela Gordon and Katrina Gilmore, and those are the people that will take your phone calls. Those are the people that will take your phone calls and get your appointments and make sure that when you're checked out, you know when your follow-up is and whatever paperwork you need. Our nurse manager is Susan. Susan's in charge of all the clinical nursing and making sure that we have all the supplies we need. We have 4 fellows. Tanya? Ken? And it sounds weird that we have wound care fellows. These are all podiatry. They were podiatry residents at once. They graduated their program, and now they're doing a year fellowship in wound care. In the whole country, there are 20 wound care fellowship spots, and our hospital trains 4 of them. So, we have 5 attendings that work in the wound care. I'm here every day of the week, and then we have a podiatrist every day. So we have Dr. Tarantino, who's the associate director. And we have Dr. Hirsch, who's the chief of podiatry. And then we have 2 other attendings. We have Chanlei Kim, who was a fellow 3 years ago here and stayed on to do wound care. And we have 1 fellow from last year, Luke Wan, who was also here. So we have 5 podiatrists here, one each day. So I think what we're going to try to do is we'll show you what the machines look like. And if you have any questions, just find me or Dr. Tarantino, and we'll try to answer whatever questions you have. Thank you all for coming in and supporting us.
Thank you so much, Dr. Lewinsky. And we have been blessed with the presence of our Senator Sanders. So we're going to ask him to give us some remarks at this time.
We thought this day would never get here. How many of you were here during Sandy? All right. Then you saw that this hospital was a bastion of safety. This was almost an island, literally, surrounded by water on all sides. We needed help. We needed the government to step in. We needed the state. We needed the city. We needed help. Today is a reflection of the help that we're getting from these places. But it's more than that. It's a reflection of the dedication of the staff working here. They could have worked many different places, but they have chosen to put their roots down in these sandy soils of the Rockaways, and they have said that here is a place that we can grow and bloom. So this is a day that I wouldn't have missed. I had another event, and if you see some police running around looking for me for speeding to get here, that's a joke, my friends. Of course, senators don't speed. Which brings me back here. So I had to get here today, and I'm glad to be here to see these lovely ribbons and lovely people that we're going to do. And I guess it's time for, when you say we need a tour?
Yes,
I think we need, anybody want to take that tour? Yes. All right, then let's take a tour. God bless you all.
Thank you, Senator. So at this time, we're going to prepare to do the ribbon cutting. So I'm going to ask Ashley to come with the ribbon. And
All right, grab what you can. There's always room in the ribbon. If you push yourself, we have plenty of help.
It's been tested. We need a good future in that.
Yeah, never take.
Yeah, great. You have medical school when you're early, huh? I will push you.
You'll be in the right place, but I'll push you.
Hope you have
I'm gonna get some photos.
cutting edge.
okay. All right, so we're going to get ready to cut. 1, 2, 3. All right. Okay, so at this time, we'll go inside and we have refreshments. Dr. Tarantino will do a tour of the Hyperbaric.